Hi, my name is Dr. Tom Sladek, and I want to welcome you to this video. And what we're going to be discussing today are the medications that you are on to prevent heart disease, may be killing you and causing heart disease. And that's something that obviously you need to find out. How this is happening is that medications deplete your body of nutrients, vital nutrients and essential nutrients, nutrients that your body needs to function and be healthy. And if you're depleting your body of these nutrients, it's going to create health problems and cause disease. So in today's video, we're going to be discussing the heart medications and what nutrients are being depleted and what you can do to protect yourself. So anytime there's a discussion about heart disease, there's a discussion about fat and cholesterol and diet. And first of all, if you're eating a low-fat, high-carb diet that they promoted in the 80s, that's the wrong thing to be doing. There's a study in 2004 by the Journal of American College of Cardiology that said that a low-fat, high-carb diet may well have played an unintended role in the current epidemics of obesity, lipid abnormalities, and metabolic syndromes. Obesity, lipid abnormalities, which means abnormal cholesterol levels, and metabolic syndrome, which is pre-diabetes, type 2 diabetes. Those are epidemics in today's society. That's a result of the way people have been eating. So for you to think that eating an egg is going to cause high cholesterol, that's not the facts today. As a matter of fact, you want to look into a Mediterranean diet, a paleo diet, a grain-free type of diet. That's what we're finding is effective today. So the low-fat model is wrong. And you need to change that. So along with fat and cholesterol, let's understand when you eat an egg or a piece of steak or some fat, olive oil or an avocado, this doesn't necessarily mean that this fat automatically gets into your bloodstream and clogs up all of the arteries and causes heart disease. As a matter of fact, only 25% of dietary intake actually ends up in the bloodstream that you can test in your blood panel. 75% of cholesterol is produced by the liver, and the liver produces cholesterol to look for a reason. And namely, if there's a lot of inflammation in the body, the liver is going to produce more cholesterol. If there's stress or trauma, cholesterol will go up. That's where you really want to bring your investigation, is look at the inflammatory process, which we're not going to get into in this video, but in later videos we'll be discussing that. So let's talk about cholesterol. Where does it come from? We know it comes from the liver. So many of you may be on a cholesterol lowering medication. You want to know what that's doing to you and what it's depleting you of. The most important molecule in the discussion of cholesterol depletion is obviously coenzyme Q10. Coenzyme Q10 production goes down as you age. So you begin producing less coenzyme Q10, which is needed for cellular energy. And the heart is the most metabolically active organ in the body, meaning it needs energy. It's pumping all day long. And CoQ10 is needed for that. So when you take a statin drug, not only as you age, CoQ10 production goes down, but statin drugs lower cholesterol levels. At the same time, they lower CoQ10 levels, leading you at risk of congestive heart failure and heart disease and arrhythmias. Let's look at the pathway so you can understand how this happens. Now, this pathway is called the Melvonic pathway, and at the top you can see Acetyl-COA, and if you follow the arrows down, all of these steps to eventually squalene, and then we produce cholesterol, CoQ10 to the one side, and dolicol to the other side. Now, if you look at the top right-hand corner of this slide, HMG coenzyme A reductase, that's an enzyme that breaks down HMG coenzyme A to further form the substances downstream. When you take a cholesterol-lowering medication, which is called a statin, follow that arrow, and statins inhibit that enzyme. So by stopping that enzyme, everything downstream is going to get shut down. So you're going to lower cholesterol production, you're also going to lower coenzyme Q10 production, you're also going to lower dolicol. Dolicol is something for memory, and if you take cholesterol medications, you will eventually be causing memory loss because the brain needs these fats. Your total cholesterol levels should not get below 150. I had a patient consult with me. She was complaining of memory problems and balance problems. Looked at her history. I asked her, how long have you been on cholesterol medication? She said, for the last 15 years. I looked at her total cholesterol number, it was 120. Now, she's complaining of memory loss, forgetfulness. Do you think there's a connection? Obviously there is. Now with CoQ10, CoQ10 is needed for the body for energy. So when you shut down CoQ10 production, you're going to inhibit muscle repair. So that means obviously that's where the muscle pains come from, but if you're exercising, you're not going to be able to recuperate from your exercise. Also CoQ10 obviously is needed to make energy for the heart. So energy for the heart, if you shut that down, that's not a good thing. So to sum it up, cholesterol medications, statins inhibit muscle repair, statins cause memory loss, and statins cause a CoQ10 deficiency, which is associated with congestive heart failure, high blood pressure, and arrhythmias. So you can see one of the medications that you're taking very well could be contributing to heart disease. Next are high blood pressure medications. Medications designed to lower your blood pressure so there's not a lot of pressure on the arterial wall, which is a good thing. However, these medications deplete your body of number one, vitamin B1, thiamine deficiency. B1 is needed for energy. The heart needs B1 for energy, again, to pump. Magnesium is a natural blood thinner. You want thin blood if you have heart disease. If you deplete your body of magnesium, you're going to get thick blood. Potassium and calcium, those two electrolytes have been shown to decrease blood pressure. Potassium and calcium are shown to decrease blood pressure. So you're taking a blood pressure medication to decrease blood pressure, and you're depleting your body of nutrients that normally decrease blood pressure. That's why over time, you may notice that you go to the doctor and say, you know, your blood pressure is starting to creep up a little bit. Maybe we need to change the drug, or maybe we need to increase the dose, because over time you're going to be depleting your body of these nutrients that naturally lower the blood pressure. CoQ10, again, high blood pressure medications deplete your body of CoQ10. So if you're taking a blood pressure medication and a statin, you're shooting your CoQ10 levels into the basement, and that's going to create problems down the road. Diuretics excrete water from your body, and if anybody's if you're on a diuretic, obviously you're going to know you lose weight, and if you stop taking your diuretics, you're going to gain weight. But anytime you flush fluid out of the body, you're going to decrease the volume of blood in your body, which is going to decrease blood pressure. There's other ways to do this with diet, lifestyle, and nutrition. But if you're on a diuretic, again, you're going to be depleting B1 thiamine. Again, energy for the heart is going to be gone. Potassium and sodium imbalance. You're going to get muscle cramps. These are electrolytes that your body needs. Uric acid levels are going to go up. Uric acid is inflammatory. When you have high uric acid levels, that's a sign of inflammation. Ladies and gentlemen, inflammation is the cause of heart disease. That's what you need to look at. And diuretics increase uric acid levels. Also, when potassium goes down, that's going to create arrhythmias. Potassium levels that go down, you're going to get arrhythmias as a result of that. Next, beta blockers. Beta blockers, and the reason I bring this up is because some of you may not know what beta blockers are for. They're a high blood pressure medication. So everything we talked about with the high blood pressure is also contributed to these beta blockers. Also, one of the side effects of beta blockers, there's a study in 2007 that showed that beta blockers cause fatigue and erectile dysfunction. Also, studies show that beta blockers increase the risk of diabetes. Now, diabetes is a risk factor for heart attack. So if you have blood sugar problems and you're diabetic, that needs to be under control. You need to manage that because blood sugar and insulin are inflammatory to the arterial wall. That's what causes heart disease. These beta blockers lead to diabetes. Can you see the problem there? Obviously, a direct correlation. That's a huge problem. ACE inhibitors, also for high blood pressure. So all of the depletions of the nutrients that come with high blood pressure medications are with ACE inhibitors. And if you're on a major ACE inhibitor and you have a dry cough 20% of the people have that, you know that it's a side effect from the ACE inhibitor. And there's some of them that are listed here for you. Aspirin. Everybody's been told to take an aspirin a day because that's going to prevent a heart attack, it's going to prevent a stroke. Aspirin depletes your body of vitamin C. Vitamin C is needed for your immune system. Also, if you have low levels of vitamin C, you're going to bruise very easily. But aspirin depletes calcium. Calcium is needed for osteoporosis, for bone, for blood pressure, tooth decay. Folate, a B vitamin, can cause heart disease, anemia, and birth abnormalities. Aspirin depletes your body of iron, which can lead to anemia. And you know, anemia means that your body is not getting oxygen. Your body needs glucose and oxygen to be healthy. If oxygen is not being delivered to the cell, it's going to create health problems. That's what anemia is. And weakness and fatigue are as a result of that. And aspirin also depletes your body of vitamin B5, which can cause fatigue and listlessness. It can cause damage to the nerves and liver. It's interesting, there's a study in 2010 by the Journal of American Medical Association that reported that aspirin had no effect on preventing heart attacks and stroke in people that did not have heart attacks or stroke. Meaning, as a preventative measure, it was not found to help. But what they did find is that in this study, 70% of the people that were on aspirin ended up being hospitalized or had an increased risk of hospitalization as a result of hemorrhage. So be careful with these medications. There's other ways to do these things. What I would suggest for you, 3 things. Number 1, find yourself a doctor, a functional medicine doctor, that's going to test micronutrients. So you can find out exactly what nutrients you're deficient in. And then number 2, find a quality functional doctor that's going to give you quality supplements to replenish these nutrients. Not all supplements are created equal. There's bad quality out there that's really not going to get anything done for you. And number 3, find a doctor that's going to help you get to the true cause of heart disease, which is inflammation, and do the tests that are necessary to uncover what's causing your problem. So, I hope you enjoyed this video. If you have any questions or need more information, please visit my website. Thank you.